Long COVID information video. Dear people in Hamburg, we have been living with the coronavirus for more than 2 years now, and many have already contracted COVID-19. This is a disease caused by the coronavirus. After the infection, the infected usually no longer have any health problems after a few days or weeks. However, some people continue to have health problems a long time after contracting COVID-19 and need more time to recover or develop new, different symptoms after contracting COVID-19. You too may have survived a COVID-19 infection some time ago and still do not feel completely healthy. In such cases, the term long COVID or post-COVID is often used. In this video, we explain exactly what long COVID is and who it affects. Long COVID complaints that last longer than 12 weeks are referred to as post-COVID. So the differences between long COVID and post-COVID is how long the symptoms last. Whether long or post-COVID are different diseases has not yet been researched. The most common signs of long COVID and post-COVID are fatigue and rapid and/or severe exhaustion after physical or mental exertion. Even a slight exertion can be distressing. This severe exhaustion also often occurs with other viral diseases, for example influenza. Difficulty thinking or concentrating has also been reported. This means that there are difficulties to remember things, to understand difficult connections, or to concentrate for a long time. However, other symptoms such as breathing problems, sleep disorders, smell and taste disorders, depression and anxiety can occur. Symptoms can vary and are not the same for everyone. A wave-like course of the complaints is typical. So there are phases when people feel better and almost normal, then there are phases in which they feel very bad again. People who have long COVID are not contagious unless they have contracted the coronavirus again. People with both mild and severe COVID-19 can develop long COVID. According to recent studies, women are more likely to be affected by long COVID than men. Children and adolescents are less likely to develop long COVID than adults. People between the ages of 30 and 50 are most commonly affected. Asthmatics, people with high blood pressure, diabetics, and the overweight are affected slightly more than others. It is estimated that around 10 to 15% of all corona-infected people develop long COVID. However, much research still needs to be done to understand and recognize long COVID. At the moment, there is no drug that directly helps with long COVID or post-COVID. If you still have health problems more than 4 weeks after a COVID-19 infection, contact your general practitioner or, in the case of children and adolescents, the pediatrician. Bring any test results you have with you to your appointment and discuss any symptoms with your GP. Therapy options include physiotherapy, occupational therapy, and speech therapy. Take it easy and take regular breaks. The symptoms often go away on their own after a few weeks. If the symptoms worsen, your family doctor can refer you to specialists or to a special long COVID outpatient clinic. A rehabilitation measure can also be carried out. The best way to protect yourself from long COVID is to have a full corona vaccination. At least 3 vaccinations and the AHA regulation. This means keeping your distance, washing your hands frequently, and wearing a mask where many people come together. If you have any questions, contact your family doctor. Below the video, you will also find further information and help. Take care of yourself and stay healthy.